for. He's a living, slipping out the back door. But it's not what you're made for, and there's nothing that is too late for.
Hi everyone, I wanted to do a video covering the topic of skin lesions with CRPS. This is something, unfortunately, that I am quite familiar with. Not a lot known on the subject, or they would have you believe not a lot known on the subject. So I've had CRPS for 6 years. You'll know if you follow my other video. So that's 2017, mine was diagnosed. Now, in 2019, I first noticed a little skin lesion. I thought it was a spot at the time. Came up just kind of by my eyebrow, was incredibly sore, but if you get a spot, as you probably know, anywhere near your eyebrow, for some reason it is painful. So I didn't really think much of it. You know, it was a little tiny spot. Didn't itch, but it was very sore just to touch. You know, it was really, really sore. So I tried to ignore it. I just thought it was one of them things. I've never really suffered with bad skin. Even as a teenager, I didn't have acne or anything like that. I did have a bit of eczema. But yeah, this little spot came up. Tried to ignore it. And before I knew it, I had one here on my face. Did the usual. It's probably stress. This was 2 years into diagnosis, so up until that point I hadn't had anything wrong with my skin apart from the usual swelling and redness, blueness, you know, all the lovely things that go with CRPS. So I tried to ignore it as long as I could, but it spread and it got worse and it was so painful. Again, no itching at all. It was just so painful. I mean, as you can see, I wear quite a lot of makeup anyway. So to clean my makeup off, I use an unfragranced baby wipe, usually. And just to try and touch my skin with the wipe, it was just so painful. So I ended up making a doctor's appointment anyway and went to see the GP and had to go without any makeup on, which was awful. Luckily, most of it was here on the lower part of my face. Anyway, I showed him, he had a look and he said, I can give you some cream for it. Asked me all the usual questions. Have you changed your soap, perfume, and all the rest of it? Couldn't get to the bottom of it, so he decided that he would refer me to the dermatologist at the hospital, which he did, and sent me away with some steroid cream. Still none the wiser. Now, at the time, I have to say, I didn't know that there were such things as skin lesions with CRPS. I really didn't know. So I came home with the cream and applied the cream, which made it worse. At that point, my arms the lower part of my arms had also started to become sore. Started with one tiny, almost comes up like a pinprick blister, which then breaks, and it seemed to spread from there, and my arm got progressively worse. And tried the creams that he gave me, to no avail. It just seemed to be making it worse. So I stopped using the cream altogether and just waited out for this dermatology appointment, which I knew was going to be a long time. Anyway, in the meantime, I had been looking on Facebook groups. I'm on a lot of CRPS Facebook groups, and I'd been scrolling through and I'd noticed a post that somebody had put up about a show that was on, I don't think it was it Netflix? No, it wasn't. It was Really TV. And it was one of the members of the group had put a link up to a program that she was on about CRPS and skin lesions. And I read it and I thought, oh, okay, maybe that's what this is. And watched the show and watched it and was just gobsmacked. This poor girl was absolutely covered in these huge like blisters. It was just awful. I couldn't believe it, and prompted me to actually find the girl and send her a message. But anyway, this was just awful. And that then prompted me to Google to find out if there was a link between skin and CRPS. And I found some pictures and I was like, that's exactly what I've got. I am going to add my pictures on here. in a moment, and you can see exactly what was going on with me. It was mainly my face and my arm. It was just so sore. So yeah, here's some pictures anyway. As you can see, it's the lower half of my face. Mainly I did have a couple on my nose. I had some on my around my eyebrow, on one side, my chin, just under my chin, and halfway up one arm. And they are as sore as they look, or they were as sore as they look. Yeah, just horrible. Anyway, this was about 6 months later. I got the appointment for the dermatologist, which came through. And I went to the hospital to see the dermatologist, explained the situation to her. She took a look and gave me some cream, sent me away, and told me that I would have to come back for a skin biopsy, which I was dreading, obviously, because of the CRPS, and it can, any needle stick can cause a spread of this horrible condition. And I wasn't looking forward to having a biopsy done. But at the same time, I wanted to know what was going on. It was starting to become disfiguring. Not so bad with the face because you can slap makeup on it. But yeah, anyway, I waited for this biopsy appointment to come through, went away with another load of topical creams that were absolutely useless, did no good. If anything, made it worse. Stopped using those. I went back for the biopsy, where they took a small section. I had a big one on my arm, and they took a small section. This is my arm now. I don't know if you can even see in this light, but I'm full of scars here, but no sores, as you can see. But yeah, they took the biopsy from just there, and they used what looked like a little apple corer, and they numbed the area, and then sort of went in and took this little sausage piece of skin, put a couple of stitches in, and sent me on my way to wait for the result. Mouthful of coffee. So that was all good fun, not. I then got another appointment to go back about the results, and when I went back, I was so excited. I thought, I'm going to be told this is to do with CRPS, and here's what it is, and take this and it'll all be fine. And it was just awful. I saw a different, I'm not sure if she might have been a dermatologist, I don't know, it was a different person anyway. And she looked at my face. She then asked me, did I have any on my back? I said no, just my face and one arm. And proceeded to tell me that I was, in fact, a little bit crazy and doing it to myself. Yeah. I was livid. I was absolutely livid. I was so angry. I mean, to be told that you're doing something to yourself, potentially, that's scarring you, that's causing you pain, that's making you embarrassed to go out, making you embarrassed not to put makeup on, affecting my life, basically, that I'm doing it to myself. I have no words. I have no words. I did actually go hand in hand with my phone, and on my phone I had some pictures of another lady that had the same sores in the same places, and I got them up. I was so angry with this person. I got these pictures up, and I said to her, see this? I said, this is CRPS patient. I said, is this not linked to my CRPS? And she got very snotty with me, and she said, I can't comment on those pictures. I don't know where you got them from. I can't comment on that. But I can absolutely tell you that the biopsy showed no significant anything, basically. Which wasn't answering my question. She wouldn't admit that it could be. I then said to her, have you seen anybody with CRPS before? And she hadn't. So with that, I got up and I walked out. As you know, if you've seen my previous videos, I've got no faith in the hospitals anyway, but this kind of just underlined for me why. Yeah, to be told that you're causing this to yourself, there's nothing worse. When I was watching the Maya trial, and that came on about the sores that she had and how they believed she was doing it to herself, I got so angry I had to stop watching. because of what I'd been through. Today, I'm happy to report that healed up. I did nothing. I stopped using the creams that they'd given me. I tried to de-stress myself, as it were, doing a bit of crochet and, trying to keep calm, thinking stress may be triggering it. And it healed. It took a long time. And it seemed just as one went down, another one would pop up. The reason that I'm doing this video now about this is because they're back. Yeah. I have one, I've got a big one here. And a couple of days ago, I noticed that my eyebrow was sore. And that's exactly where it started before. In fact, it left a scar. I don't actually have any hair there anymore. But yeah, I've noticed that I'm getting, you see that? I've got one there on my hand, there. Don't know if you can see that. But yeah, they're coming back, and I know what it is now. I don't need to go to the doctor to be told that it's nothing and take some cream that's not going to work. Don't need to go to the hospital to be told you're doing it to yourself. No, I'm not doing it to myself. I have one on the back of my neck. I have a big one that's come up in my hair, on my scalp, just back here. That was really painful to try and brush my hair. I've got one on my shoulder here, always in awkward places. So yeah, that was the reason that I wanted to do this video, because it is a big thing, and I know people do suffer with it. And to be told that you are self-inflicting horrendous wounds on yourself is just, it's horrible. So yeah, I hope if there's anyone out there that is suffering with sores that has CRPS, please know that it is related. You're not going crazy. You're not doing it to yourself. Obviously, I won't say don't try any medications that the doctor give you. In my case, I didn't. I stopped because they were making it worse. So try them. If it makes it worse, stop using the topical creams if it's making it worse, and get a second opinion. I won't, because I don't like the hospitals, but there's nothing stopping you from asking for a second opinion. And, it's important because these do scar, and it's really horrible, when you're embarrassed to leave the house or you're embarrassed to see people because of how you look. And there's nothing that is causing it. As far as the doctors are concerned, there's nothing that's causing it. It's all in your head, or you're doing it to yourself, or it's horrible. But please know you're not alone. It really does exist. Please leave a comment if this is something that affects you. And if you haven't subscribed, please subscribe. If you hit the little bell, you'll get a notification pop up when the next video comes up. Please like this video if you found it helpful. Obviously, watch it all the way through before you hit the like. I don't expect anyone to hit the like before they've actually watched what's in it. Have a good day, everybody. Thank you for watching. I'm going to carry on with my coffee now. See you soon.
You got it made for easy living, slipping out the back door. But it's not what you're made for, and there's nothing that is too late for.